According to CDC.org, 1 in 54 children is diagnosed with autism in the United States. And you probably know somebody who has it. My son himself was diagnosed with autism at the age of 1.5. And because of this personal experience, it has driven me to talk about the warning signs, diagnosis and treatment, and the causes and risk factors. So let's start with warning signs. First up, we have delays, which would be regression. According to verywellhealth.com, not playing pretend or playing make-believe, not working with simple toys, not making eye contact, and not babbling or talking. And when we go into babbling and talking, we go into the habits, which would be repeating words or replacing them with their own nonsensical words. According to cdc.gov, repetitive play, not cuddling or only cuddling when want to, and routine changes. One slight routine change and the entire routine is thrown off. And when we get into cuddling, we also get into other sensory sensitivities, which would be loud noises, light, gentle touch, and flashing lights. So if you think that somebody has autism, how do you get a diagnosis? So what we did was we went to our pediatrician who sent us to early intervention. And early intervention knows the same things that we did. So they sent us over to Vanderbilt University. And we were able to get my son diagnosed there. So if you think that somebody close to you has autism spectrum disorder, then the best thing to do would be go to your primary care physician or pediatrician, or go to a psychologist. There is no cure, but there is plenty of treatment options. The current treatment that I have for Damon is speech therapy, and we're getting him into behavioral therapy. Causes and risk factors. One of the causes would be genetics, such as having siblings who have autism spectrum disorder. 2 drugs, one of which is banned in the United States, valproic acid and thalidomide, which valproic acid is prescribed for seizures, and thalidomide was a sedative. It's the banned one. And it was given to women who were pregnant. Having older parents can be one of the possible causes for autism, but definitely not vaccines, as it was highly believed for a long time. The CDC website specifically states not vaccines. Some of the risk factors would be that it is 4 times more common in boys, so gender is a risk factor. And according to mayoclinic.org, family history, other disorders such as tuberous sclerosis, Rett syndrome, and being born premature. So far we have covered the warning signs, diagnosis and treatment options, and the causes and risk factors. So some of the warning signs: habits, delays, diagnosis and treatments, what I did and what you can do, and then causes and risk factors. So 1 in 54 children has autism. And now you know how to get them diagnosed and get them help. Thank you.